specialist in Newport Beach, California. I'm going to go over a little bit about what I do, which is mostly with acne and scars and pigmentation, as well as with collagen production. And I'm going to go through just the best practices that we could use to achieve excellent results over and over and over again for really any condition that we're treating. And I'll walk you through just not just this case, but also a lot of other questions that I've had over the last couple of days since I've come back. I've been doing this show for more than a year now, and it's been really incredible, just the level of feedback that I've received from patients, and just I think that we've been able to help a lot of people with their scars and also just the mental health aspects of skin conditions. So I think it's going to be really valuable for all of us to, ask questions wherever you feel like, and I'll be happy to help you out with it. I've noticed that there's a bit of an issue with my stream, so I am going to reset this in just one moment here and then try again. Oh, actually, it looks like we should be okay. So I'm going to go forward and with this. I think everyone's saying it should be okay. All right, perfect, everybody. So for those just joining, I'm Dr. Qazi. I'm a skin restoration specialist. I'm over in Newport Beach, California. And we're going to go through and talk you through how I do skin restoration and just overall what we could do for not just for scars, but for pigmentation, for collagen production, anti-aging, all those things that, buzzwords that are kind of out there also. With a lot of people have been asking about exosomes, about stem cells, and what role they have within the scar world. I think is really important also for us to kind of go over. PRP is another topic that I'll hit a little bit today because I get so many questions about PRP all the time. Every time I'm on here, someone will say that they were sold a package for PRP, they were doing this, and I think again it's something that it's worth going into, and because I kind of got tricked also a little bit because I was told that it would help with a lot of scars, and it was really more for like the healing process, not so much for scars. And I think it's worth you guys knowing about that so you don't get tricked into big packages. Hi Joey, how's it going? Good evening for everybody. User not found is saying, what do you suggest for under the skin pimples? Well, if they're deep, thick pimples, or I guess what I'm assuming is you mean that it's a hard nodule, not necessarily a bacteria component to it. Is that what I'm guessing you're saying? In that case, you do want to do things to control oil a little bit better. So either you could do something like adapalene, which is something nice over the counter that will potentially help with you. Or you could also do tretinoin. That's a good option. You could also do oral medications, oral antibiotics, something like doxycycline is an oral antibiotic, dapsone, if it's like, these are all for bacterial infections. And then also you could do Accutane or the cure laser. All options really depends on what's happening really with your acne. Michelle is asking, would you recommend trying Accutane without antibiotics first? Because I'm scared of ruining my gut health. So essentially, Michelle is asking, can you just jump right into doing Accutane instead of doing antibiotics? Well, you could do topical antibiotics. I wouldn't necessarily say that you have to do oral antibiotics before you do Accutane, but you really should do topical antibiotics. Accutane is not going to just immediately solve that bacterial component that's occurring for your acne and it's causing your acne. So the best thing to actually do is to do things to solve that bacteria overgrowth, which will be something like topical dapsone or topical clindamycin. Those are options. And then you may need to be on an oral medication if you could tolerate that, oral antibiotic as well. Today I had a patient who was saying that she had so many different antibiotic allergies, which I want to actually educate people about a little bit about with antibiotic allergies. It's very, very rare to have like true antibiotic allergies, true like penicillin allergies. In fact, they had a study years ago, I think it was about 10 years ago now, where they were evaluating people that stated that they had penicillin allergies. And in fact, they even included some patients who supposedly had they thought anaphylactic reactions, or they felt that the throat was closing, things like that. And I believe it was like out of 100 people or so, only 1 or 2 of those patients actually were positive for true penicillin allergy. So interestingly enough, a lot of people say that they have an allergy to an antibiotic, but sometimes it's also because of like cross reaction, like what else they're on, things like that. It's not necessarily like a true allergy. So just pay attention to that. But gut health, yes, that is something to pay attention to, that when you're on antibiotics for a while, you really could crush your GI flora. It really could destroy that. It really does affect that quite a bit. Even sometimes for patients who are on patients who are doing probiotics, it may help a little bit, but they still may end up getting a lot of the side effects of bad gut flora, essentially, or I should say the good gut flora getting knocked out, and then the bad gut flora proliferating due to the oral antibiotics. But that's not going to happen really if you're just doing a short burst, just like 100 milligrams twice a day of doxycycline for a week. That's going to be okay. What is the best treatment for open pores? Can you please suggest? Well, a lot of people think that things are pores, but they actually are more really what they are is tiny little ice pick scars in some patients. So take a look and see what exactly do you have. Do you actually have true pores, or is it possible that you have more scars? You can see when you're looking at it, like, is it thick around the edges of that pore? You can see how deep it is, how wide it is. That will actually help you out with that. The temple result is impressive for this patient. The cheek result is impressive here. And this is a patient Fitzpatrick 6, and we were able to achieve that. So it's pretty cool that we could be able to get that, though. For a lot of patients, it's like, there's a lot of questions about what we could do for certain skin types. And it really is possible. It is absolutely possible to be able to achieve excellent results no matter what your skin type is. It just sometimes could take a little bit more work. Sometimes it's like, we can't just do one way and burn it down with a laser and then like call it a day. Sometimes you have to do manual work. Like in this case, we did subcision, we did Bellafill for this patient, we did TCA Cross. Those are things that worked out really well for him. But it's possible, though, that we wouldn't have been able to achieve these kind of results with just lasers. I don't think that we would have. And if he was a lighter skin type, I may have been able to kind of push it with a laser. But there's still this area where it was still pulled down. You can see where it's really stuck right over there. You could also see that he had these thick edges of the scar, things like that. So we had to do a few different tricks in order to improve that. It wasn't just going to be a matter of just doing one modality and just like calling it a day. And I always kind of see that, a lot of times I'll see people say, well, I was just recommended microneedling sessions or laser. What do you think? I don't know, because the chances are it's like going to be difficult to solve these scars with just microneedling or laser, really, to be honest with you. Especially, this patient, he came in from New Orleans, and clearly he had done, actually he did multiple sessions of, in his case, he did Fraxel laser or microneedling, I believe. Sorry, he just did microneedling, and it just didn't help him at all. So it just, came to me and we did 2 sessions there, and significant improvement there. You could take a look and see really, really nice improvement of the skin quality, and then also that volume loss has been solved. Audrey saying, can estheticians do much for improving acne scars, or only doctors? I was considering a career change to help others who struggle with their skin like I do. It's a good question, Audrey, and I think it's worth really investigating. What can estheticians do for scars? I don't really think too much, to be totally frank. I think that they could help a little bit with some of the congestion that occurs in the skin, and clearing some of that up. I think is really nice. But I have seen, I'll be totally frank with you, because I do so much with scars. I see so many times with patients where you'll see the nail marks that have occurred because they went to facialists and things like that, and they didn't pick themselves. They went to what they thought was a professional, and they have like these nail marks, these nail scars that are there, which are harder to treat than the acne. Than the acne scars. And so it's kind of tough, to sometimes see those things. I do think there's a role for estheticians in these type of things, though, for is like an adjunct for certain things. just like a facials just for like the right patient population. But I've also seen, again, I'll just be totally clear about this. I've seen estheticians who have gotten people off of medicated creams, I'm talking like tretinoin or antibiotics, and they've, they sold them these creams that they conveniently have in stock, which they think is like the best cream ever for acne, but really it's just like the rep was really good for them and gave them a great deal. And, that I think is really unethical, and it's really unfortunate that occurs. And I think we all know that could happen. But it's, really too bad, because these are medical conditions, and they kind of sometimes can frustrate some of those things. So it depends on who someone is and like how ethical it is. It's nice that you have suffered from some of these things you're saying, and like I think you're going to be aware of making sure that you don't trick patients and things that or your clients. But a lot of people do, and some of them, estheticians just never had any of these kind of skin conditions, and I don't think they really have the empathy sometimes that's needed for us, because it really should be that like this is a medical condition. You just got to treat this medically. This is something that you need just to get that under control better. But they'll have like patients with cystic acne that I had a patient who was just doing facials like for years, and it was just like craters, and it's like terrible that the esthetician told, like he thought that it was just some people think they're a medical professional itself, which I think it's problematic. The term really implies that there's like a diagnosis that's occurring, and there's a patient relationship too. And I think that's all kind of problematic. So I don't think that there's too much that could be done for scars by esthetician. I mean, maybe light for very, very mild scars, maybe a little bit of microneedling, but probably not so much of that. Audrey saying that I would sue someone who gave me scars like that from a facialist. But the problem is that the esthetician board is really more designed to protect estheticians than the clients. At least that's my impression of it, to be honest with you. There's a lot of estheticians out here who do energy devices with IPLs and things like that, and they're really not supposed to be doing that. Or even lasers in California, it's only supposed to be done by RN, PAs, or physicians. And sometimes you'll discover that they got burned by an esthetician, or the plasma pen. Fortunately, I think that died down recently, but plasma pen was just going wild for like a year until everyone realized that was burning everything. And so that was being done a lot by a lot of estheticians too, unfortunately. So I do think there's a role for the right ethical ones, but unfortunately a lot of unscrupulous ones are in that industry, and sort of felt like, I had some acne and I care about this world. But when they're in it, they're starting to see the dollar signs and start to say maybe we could just sell them this this treatment package and all these creams, hundreds of dollars worth of creams, which is really unfortunate, because for acne especially, really does not take much at all for controlling it with topical creams. Yes, try it, do those things with topical antibiotics and tretinoin. They do work, they do help. It may not be enough for severe cystic acne, but it could help. It could be it could be the case that your mild acne gets under control with a topical retinoid and potentially a topical antibiotic if it's needed. And you certainly didn't need to buy, the $1,000, $2,000 worth of creams that someone's selling, or even the few $100s worth of creams for acne purposes. It's really unfortunate that that's where the industry kind of pushed. And when I was starting, in this area in 2015, everyone was talking about medical grade skincare. We're talking about that over and over and over, all the conferences, medical grade. And you're sort of just naive to it, don't really understand what they're referring to. You're assuming that it means that it's done with the lab, it's done with FDA process, something along those lines. And it turns out none of that's the case. None of it is. It's just a made up term that they did. It's just this this thing that they said, marketing trick that they did, which was medical grade skincare. I don't know to this day what that means. I really don't. And everybody says, in order to do these treatments, like this patient right here, you had to do, thousands of dollars worth of skincare afterwards. And the reason why you didn't get excellent results is because you didn't do my skincare line, blah, 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 blah. And we got excellent results without that. We put the patients on CeraVe, Cetaphil, gentle lotions. We did physical sunblock afterwards. And those are things that ended up working, and it worked out. That's all we ended up needing. Just we need a pigmentation cream, but beyond that, it's like very, very straightforward. Keep it really easy. And I don't use hydroquinone. Actually, these darker skin types too, we're not using hydroquinone. I avoid it actually as much as I could. Actually, I hardly ever use hydroquinone especially for pre-treatment and post-treatment for these patients. So interesting stuff. Like when you think about like the way that everybody was acting, like in this whole time for more than a decade, when I was definitely doing these procedures, everything like that, there was like, oh, you got to do XYZ. And or you got to have like this skincare line, you got to have you got to sell this stuff. I had a guy one time when he was like he was talking to me, and he was just a really frustrating rep. I don't know why. Like sometimes the reps would bring like their manager who's in the area, and it's like, dude, I was just like gonna talk to you for a second, and then you brought like your manager or something like that. And now we're like they're like and the manager a lot of times is like trying to show off that they are like excellent salespeople or something, and the dude's talking about how like skincare has to be like this percentage of your revenue, blah 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 blah, and our products are like peptides and amino acids. And I was like, what does this mean actually? What do you mean by this? What does this mean that it's peptides and amino acids? Like what are you referring to when you're saying this? Just like curiously, what do you mean by that? And it's just, I never got asked that question, I guess. I don't know. What are you saying? Like, what do you mean when you're saying peptides? It's got peptides and it's got amino acids, and like sure, like cool. Everything's like got something out of amino acids, and like, but what amino acids are you referring to? What, like, be specific a little bit here. That what exactly is the thing that's different for maker for you, and it's justifying you to have this $120 to $200 cream. No, I don't know what the answer is. Still to this day, I don't know. They're out of business now, actually, that company. Are you familiar with Alastin Skincare? I've used some of their products and I do like them. Yeah, I do like their skin nectar. It's really pricey though, which is why I never really push it ever. Like and I don't think that we really need to. Sorry, I just had a chip, so I got a little stuck. But Alastin's... I do think Alastin Skin Nectar has been helpful for patients post-recovery. For a lot of patients, I don't actually push it as much for my scar patients because they're more acne prone, and sometimes I think it can break patients out. So I think there's a bit of an element where it's okay for like anti-aging purposes, like if we're doing things like ablative CO2 laser, things like that, and then you do the Alastin Skin Nectar afterwards. It's expensive, but does make sense. It works out pretty well for that. I haven't really been doing too much of it with acne scar patients, to be honest with you. Here and there I do it, but I don't really push it, to be honest with you. It's a nice product. It's really pricey, and so I'd rather you put it towards like doing the lasers and things like that, because I could definitely improve that really well. Let's see here. I wouldn't recommend Bellafill. If anything, Juvederm would be better, but that's just my option. I would never recommend Juvederm for stuff like this. I'm not sure what you're referring to for scars. You're saying this patient right here was with Bellafill. This patient. I'm not sure what's going on. Why are people saying that right now about Bellafill on that you would choose Juvederm over Bellafill? That's kind of surprising, actually, especially because the complications that I see. I've never dealt with a single time for any of my patients, a single time has there been a nodule from Bellafill, but with like Juvederm and some other products, yeah, I've dealt with a lot of nodules that I had to dissolve from other, I don't do any Juvederm in my practice, but I have an ultrasound machine and I dissolve a ton, and I dissolved so many nodules. So I don't know, make that, and sometimes it's really tough to dissolve. Juvederm can be very, very tough to dissolve. People seem to think that it's just like an easy product. It's temporary too. And I think we've learned now that it's not really. I think it should be pretty clear now to everybody that these products can last a lot longer than everybody said. And it's not like that year, especially if it's like superficial, it can last a little bit longer. Let's see, I missed a few things here. What you do to your skin, it looks flawless. It's up and down. Sometimes it looks great, sometimes it doesn't. Sometimes I look at it as like, it looks amazing. Sometimes it's not. It's just like that's how the real skin is. Sometimes it's like I do feel like yes, today it looked like really cool. I was like really happy with it. But then sometimes it's like I'm exhausted and it just doesn't look that great. It look as fresh, and it's just normal to have it like up and down. But I mostly do a little bit of a pigmentation cream, and then I do moisturizer and sunblock pretty much almost every day. And here and there, like especially in the wintertime, I do like once to twice a week. I'll do a little bit of a retinoid. So that's typically my regimen. I've been using like a retinoid since I was 16 years old. I think that's really one of the biggest things is actually using a retinoid. It's kind of funny, right? Like that, like there's all these other people out there that are talking about all these different skincare things. And it turns out like the basics, like topical retinoid is one of the most important things ever. And it's really funny because I actually did when again, I was like, I talked to all those reps when I was opening my practice, and so many physicians were telling me different things. And I had bought a whole bunch of skincare lines and all sorts of stuff. And I was like, I just keep on going back towards, retinoids because that's what I love doing. And I just never ended up selling like my stuff, like, cause I was like, like the other products, because I was like, I just feel like you don't really need that. All we need to do is just work out with the retinoid. So if you really, if I feel like you need to do something which is more medical for other things, for pigmentation, things like that, I'll let you know. But in general, for vast majority of people, a retinoid is one of the biggest things you could do. Sunblock, moisturizer. That's pretty much it. And it's kind of funny because there's so many people that will say, I spent this much money on my skincare routine, all that stuff. And I don't know, do you have a retinoid in your pocket? Because that's all you really need to do. Let's see here. Someone's saying that my scars look so haggard by the end of the day. Yeah, it's a common complaint, honestly. It's like you just look exhausted and dull, and like you're less hydrated. And then, it looks like it's more prominent now suddenly. Will tretinoin get rid of post-inflammatory hyperpigmentation? A little bit. It's a little bit mild exfoliant with that, and so it could help with that. User 72 is saying, in my personal opinion, I think fillers are a high risk, not big reward. They have so many better options. That's a good question that you're asking about better options. What are the better options if you have severe volume loss? I think it's a good question to actually ask. Audrey's saying Bellafill gets a bad rep on Reddit. I don't know why, but so does subcision with people who aren't doctors. Yeah, I mean, I think Reddit has its place. I think that's important to, have a forum where people could look into things and ask questions and have that. But that's why I partially do these. That's why I come on here, so you could just hear from me, and I'll just tell you directly what you need to do and hear it, and say it over and over and over again. And a lot of you will see like patients jump on here, things like that, and talk about, like, there was a patient, I missed it actually earlier, who was talking about how they were so happy with the result that they had. And I love that. I appreciate that. And I think they will get much more of like I guess a different perspective, a more realistic perspective from that, and like we could showcase over and over and over again the safety that we have and things of that nature. There's absolutely risk with every single treatment that's out there. There's no question about that. And I do think that the people who say not to inject Bellafill, the ones who, the physicians out there who say, I'm not comfortable doing Bellafill, I don't want to have my nurses or PAs do Bellafill, they really shouldn't. And it's totally appropriate to just not do every single treatment that's available out there. You're not comfortable with it, that's okay. But what I don't like is just the misinformation campaign that goes out there with this stuff, because they make it seem as if there's like this, that there's this like high risk of doing these things, where if you're doing it safely, there isn't. And if you're doing it correctly with like, the proper real products, all those type of things, which, believe it or not, is an interesting thing, because there was a person over here that, he was doing Bellafill for super, super cheap. And the rep told me that he hadn't made an order in like years and years and years. And he's not sure where he gets the Bellafill from. So that's kind of concerning, right? Because it's like a permanent collagen-based product. It's a collagen-producing product that has a permanence to it, and it potentially can't be sourced properly. So those kind of things, do happen. And it's like, I'm not sure, what product they're even using occasionally and things like that. So I'm not sure. And where they got their training and all those things all factor into it. And honestly, sometimes watch the way they do the filler. Like, you'll be surprised by like the way that people do filler. Like, it's like, I guess you wouldn't be surprised with looking at some of you, but like, really, it's like, I don't know, like just because you could have a license to do something doesn't mean you should do it, I expect to pay between, okay, yeah. So basically most patients pay about $5,000 to $7,000 for their scar treatments. Most patients are $5,000 to $7,000. TCA Cross works best on which patients and which scars. So I actually do it for almost all types of scars, interestingly enough. But mostly it's for ice pick scars, but I also definitely love doing it for Boxcar scars. And then here and there, I'll do it for some rolling scars as well. So I do it actually for almost all scars, interestingly enough. Foreign Cooks is saying some people end up with bigger scars with punch excision. Is this a common risk? It depends on where it's located. It depends on how much tension is there in the, like for example, if you do it along the nasolabial fold, there's a chance that you could stretch out the scar a little bit there, and then that could actually end up causing it to get a little bit wider. That sometimes could last a little bit longer. Sometimes though, if it's a little bit larger, it actually could get a little bit wider before it contracts. In fact, I've had a few patients where that's occurred, where for the first few weeks, even a couple months actually, it looks a little bit wider and then it contracts. That could happen as well. And partially that's actually sometimes due to oil production. It just sort of fluctuates if you combine it with another treatment, maybe like a laser, for example, that day, or some other things that could have occurred. Maybe you have excess oil production at that point. And now like that oil has made the scar get a little bit wider, but it contracts. And sometimes though, if it is like a bit of a wide excision or some other issue that occurred with the excision, then yes, it could last where it's wider. I would say that's a very, very rare complication though, extremely rare. And I don't know, like worldwide what it is, but I just, here and there I see it where along the nasolabial fold, I've had patients, there was somebody who was doing it in Texas, all these excisions on the nasolabial fold, and I've had so many people where it got wide and I've had to fix that. So it could occur depending on where the location is. There's something called Langer's lines. I showed some photos of it before. I'll try to pop it up at some point again, maybe during this week, you can see what I'm talking about. But there's these lines that we follow when we do excisions. And if you don't follow those lines, and even some plastic surgeons do not follow those lines appropriately, then you could run into problems. You could run into it where if you're doing it more where it's perpendicular to that line, you get so much tension that the scar gets wider. And that could be a problem. Devaz is saying, I'm getting Morpheus 8 for my ice pick scars. I'm sorry to hear that, Devaz. Really, I'm sorry. So I'm sorry that someone did that to you. Does tretinoin help with PIE and atrophic acne scars? Tretinoin is going to help a little bit with atrophic scars, like a little bit, because it stimulates some collagen production with reducing the oil production, it stimulates it, and so you get some improvement from that. But it's definitely not going to be like enough for, like, especially like this patient's scars, not going to solve these kind of scars. So not going to help enough for that. Now for PIE, can it help a little bit? Yeah, it's a mild exfoliant. It'll help a little bit with that, but there's better options out there than tretinoin, I would say, for PIE. Let's see here. Thanks, user72, for answering questions, by the way. I appreciate you. Are those rolling or Boxcar scars near the eye area? So near the temple area, those are Boxcar scars, very deep Boxcar scars. And what treatment was it done over there? We did some subcision, and then we also did Bellafill over there. So we did, and also TCA Cross. So I did TCA Cross, subcision, Bellafill. Tricky case, Fitzpatrick 6. Patient also not local, coming in from, came in from New Orleans. That's how we worked it. Dr. Fadi's on. Dr. Fadi, how's it going? Good seeing you on, actually. Hopefully you're doing okay. You're always jetting around. Hopefully everything's okay, safe for you over there. Devaz is saying, are Morpheus 8 results permanent for acne scars? Which treatment is permanent? Well, there I was just talking about Morpheus 8 for scars. Dr. Fadi likes Morpheus 8 for skin tightening. He does a lot for skin tightening. I don't think that you would be pushing it for those ice pick scars that you were talking about but for skin tightening purposes. So let's say you have a lot of acne and you have a lot of scars, and then it causes some laxity over there. Then you may need to do something for skin tightening. In that case, Morpheus 8 could help. But for the scars themselves, pretty mild, pretty minimal for that. Definitely there's better options, really things like TCA Cross for ice pick scars, Excisions for ice pick scars, all better options than doing Morpheus 8. Sorry, Fadi. Sorry. But, it's true. The truth is, I know you know that's true too, because it's like we know that like there's ways of doing it, safely, there's ways of being careful with it, but and I know that you are a big believer in doing it for skin tightening purposes for scars and some collagen production, but definitely for like just ice pick scars by itself, need more things like manual type of things where TCA Cross, Excision, those are going to be really valuable for you. Do collagen supplements work? Good question. I investigated last year, like kind of just casually with patients and online on here and things of that nature. Nobody really said that they were like blown away by it. Honestly, nobody ever found it. They were blown away by collagen supplements. Some people said it helped me a little bit, but I had so many patients who had great results without it. I do think that for like the initial portion, it's possible. And I do think that it may help actually for immediately if we do ablative CO2 laser, using collagen actually could be a good option. Collagen supplementation for that purpose may be okay, but for like long-term use, kind of still up in the air, and I'm open to still investigate. I'm actually going to do another laser on myself. I don't know, maybe this month or something. I'll try to do. Dr. Fadi is saying he agrees 100% with what I was saying. Appreciate you. And for those who don't know, Dr. Fadi actually worked on my scars actually a couple years ago. He's an excellent, amazing physician. One of the only people I was trusting with my face, and really, really good guy. So just, I think a lot of you guys know the story, but you guys saw that I did a little bit more with the laser session about almost 2 years ago now. And I really did feel like it took 1.5 years for my skin to get better, like in terms of like just skin quality, the scars, everything like that, to get really, really good, which is really interesting because I was always saying it takes 6 months. For myself, it took really 1.5 years. Hiro Tite is saying, I have a deep boxcar scar from chickenpox. I got TCA Cross and microneedling 2 weeks ago. Skin around it seems pink and thicker around it and still red. How long does it take to fully heal? Well, you did it with microneedling, so that's going to take a little bit longer for the recovery. Expect it really to take probably about 2 to 4 more weeks really for it to improve, depending on the concentration that they did for for the TCA, and then also for the concentration of the acid that they used. Hopefully it was done properly. I don't actually usually recommend doing microneedling with TCA the same day. I do laser the same day as TCA, but I don't usually do microneedling with TCA the same day. Let's see here. I missed a few things here on my app. I was prescribed by the dermatologist. I missed a bunch of things here. Oh, Foreign Cook saying, why not punch excision for the temple scar, or punch excision is only for round, deep scars? No, we could have done punch excision for that. It's a matter because, he wasn't local to me. And sometimes you have to monitor that excision. Sometimes you can notice that it would have to be a pretty wide one in this case. There's multiple in a whole cluster, which means that there's going to be more tension on the scar as he contracts it. So there's a few things actually like that I was kind of looking at that, it wasn't going to change too much for me because I knew that if I placed a little bit of volume, I was going to pop it up there, and it worked out incredibly well for us. So I didn't end up needing, but certainly if it was just like one scar, deep boxcar scar, we could have done that, or punch elevation, which is another trick we could use. We could basically take out a bit of the scar that's deep inside, pull it up, and make it into a more level, just a more even level now. Where was I at though? Oh, Tichan's, hi Tichan, how's it going? Tichan did her treatment yesterday. Let's see what Tichan is asking here. Tichan is asking, hi doc, is it normal to still have some new bleeding today, 1 day post acne scar treatment? Yes, it is normal that first couple days you're going to have that, where a lot of times you'll have some pinpoint bleeding. Some of the scabs are going to start coming off as well. I like to keep the scabs on a little bit longer than a lot of other practices, but I do actually have this, a process where we will wipe out some of those scabs over the next 4 days or so. But yes, it's totally normal to have some of that. Any benefits from the red light mask for scarring? Well, it's good for collagen stimulation. It's not going to hurt for any of that. I don't think it's going to help much for scars, though, to be honest with you. These are deep scars, not, just doing external, a little bit of collagen stimulation like that, not going to change too much for remodeling the skin. So is punch excision an easier treatment with better results, but you did this method because of size? No. Well, it's a couple things. I should be able to zoom in, so I'll be able to explain it a little bit better if I zoom in here. Let's see if I could get this clear for you. If I could zoom into this temple area, I think you could see it better. Okay, let's see if I could get to it. Okay, hopefully you could see it now. Let's see, maybe I should get a little bit bigger actually. So look at that. You could see he had a few kind of clustered together. And actually now if you look at it kind of closer, it's kind of like, it wasn't that deep. Like, yes, is it maybe that big one superior, the top one there, maybe I could have done that. But the bottom one, like to its right, the lower right, also is just as deep. And so now it's like you take out that one, you take out the other one. Now there's going to be more tension on the scar, and it potentially could get wider. And so that's why I didn't do punch excision actually in this case. That's actually the reason why. So it was like kind of stacked together like this. When it's stacked together like that, not going to be great. Now, what I was referring to, like a wider, like, yes, could we do like a big, like take a big chunk of that and make a new scar out of it? Yes, but there's more risk involved now. It's not necessary. So better for us to just go underneath the tissue, undermine that scar tissue, and then put a little bit of volume in there. If it was just one scar there, then yes, we could have pushed to maybe do just a punch excision just for that single scar. Then yes, you're correct. And you can see these are really classic rolling scars. So look at that. That's a really, really big chunk. That's a rolling scar right there. So hopefully that answered your question. I like that question though, so that's why I wanted to showcase that a little bit more about why we did not do excision in this case. You can see pretty nicely when you zoom in how it's stacked, it's close together. And it's not going to really improve if we just took that one out. I'm not sure what that's going to really help us out with, and more risk involved now with that. Let's see here, and I would love to get laser, but it's so expensive. Well, you may not need laser. Maybe other things. Maybe you have to do something else. Maybe it's not laser. That's why. Cara is saying, you mentioned estimated cost between $5,000 to $7,000. Is that for one treatment or multiple if someone needs more than one session? Usually the combination session and then maybe a little bit of volume would be about $5,000 to $7,000. But yes, future sessions would be additional costs, but it's 55% off for like extra laser, extra TCA Cross. So yeah, even if I've used subcision again, so things like that. So yeah, pretty cool. And why not use this method with singular scars? Would punch work better with singular scars? I would say yes. If it was a singular deep Boxcar scar like that, punch excision would have been great. A small, more narrow ice pick scar, punch excision would have been great. So yes, you're correct. That would have been fine. I promise this year I'm going to see you. I have to. It's a goal of mine. I appreciate you. I will be here. We'll be happy to help you out. I'm on here all the time to help you, and feel free to ask any more questions. I'm running out of time for tonight. I kind of went overboard, but I had a lot of interaction on different platforms here. I think I may have missed a bunch of questions, so I'm trying to get back to a few people who are asking some things. Do you need filler for deep scars like this? Yes, you do. You really do. You need to do something. So volume is important. Fat transfer. This patient had almost no fat, or you could do, in the right patient, Bellafill, Radiesse, Sculptra, all good options. It just depends. Hyaluronic acid, if you need to, if you want to, we could do that. But otherwise, I would prefer to do more things with collagen stimulation, things like that. I appreciate you, Audrey. Thank you. Why not the method used on this patient, but on singular scars? I guess I missed the question for foreign cooks. You said that you meant on this patient. I guess I misread it. If you could repeat that before I jump off, because there's a few questions. I kind of missed a bunch of stuff there. And where was I at? Can I get pico laser while on hydroquinone? Yes, but there is more risk of hypopigmentation, more risk of that. So be careful with that. Levi, no problem. Happy to help. And, hopefully, someone on here was still saying that they had, was sold a package of combination for Morpheus 8, etc., for their scars. And microneedling for the scars like that, I want everybody just to learn just the right things for scars. Hopefully you guys are learning that. Dame Coley saying, what if you lose weight after fillers and lasers? Does it affect the scars and skin? Or how does I guess you were saying, how does it affect the scars and the skin? So what if you lose weight after the fillers and laser? Good question. And something really worth taking a look at, because there's no question that fat is a critical component for scars. And if you lose your fat, either due to your scars or due to your aging, your scars are going to look a lot worse. There's just no way around it. So that's why I do actually love products like Bellafill, because there's 20% of it that remains there and continues to provide a scaffold for the scars. But yeah, if you opt not to do Bellafill, if you're doing more like fat transfer or Sculptra or Radius or hyaluronic acid filler, as those products go down and you lose weight, then yes, you will see the scars a little bit more again. And you'll have to put a little bit more in there. There's just no way around it for volume. We don't have an option that's just going to stay there. Like you do it one time, you just walk away, and it's going to look exactly the same. There's some people that push silicone injections. Silicone injections, the FDA has actually, I'm not like a fan of the FDA. I'm not like sitting here like singing about the FDA all day long. But there's certain things like you have to look at, like why is it that they put a letter out there against doing silicone injections? And it's because we see so many complications of silicone injections. So many different times there'll be complications of silicone injections where it's shifted, or it's called granulomas, or it's or new scar tissue, things like that. And the other thing with silicone injections, you need multiple times as well. It's not just a one and done type of thing. So silicone injections, out. So what else is permanent? Well, that's where really something like Bellafill will be good, because at least there we have 20% of that's going to stay there continuously. We know that for 5 years it's there, and around that 20%, you create more collagen, which is awesome, especially for scars. It's the only FDA-approved product for scars. And again, I'm not like this big guy about like just rah FDA, but like there's an element there where they did go through research and studies, and there's and companies with more money than Suniva had, didn't get their products approved for scars. So kind of interesting, that they were able to showcase over and over and over that's safe, and I've seen it myself that's safe. Over and over and over, it's safe. It depends on the way people are injecting it. I think that they have to inject it differently. Adi's saying, I want to get this for my wife. Where can I make an appointment? And go through my page. You'll be able to go through my profile, and you can actually just make an appointment directly. I appreciate it. You're so nice, actually, by the way. We should all give a round of applause to Ade, who is an excellent husband, because he has recognized that, maybe his wife is worried about this, and he's trying to help her out. Although Ade, hopefully it's not like you putting pressure on it in order to do it. In that case, that's different. But hopefully it's like you just you're trying to help her and support her, and that's awesome. Is subcision always needed for textured scars? No, it's really more for those deep rolling scars. That's what it's really for. It's not really for just texture by itself. And I think you're going to do PRP. No, this is not microneedling PRP. This is with Taylor Liberator subcision. This is with TCA Cross. This is with Bellafill in this case. Can I completely get rid of this patient's scars? Good question. I don't know. I don't know. I think it'll get better and better. I don't know if it'll go completely away. There's especially if he looks under certain lighting, I think he's always going to still see some atrophy, some texture issues. It's always going to be there. I think that glass skin stuff has really been a problem for a lot of people because they're just pushing glass skin. But it's possible to get really excellent results. I think that's what we should shoot for. Ade is saying, nope, definitely she asked me for it for Christmas. That's awesome, Ade. You're so good. That's awesome. That's really nice. I love it. I love that. And let's see, I went overboard. I'm actually going to wrap up right now, but my appointment, Blossom is saying that her appointment is booked. And for those who don't know, thank you, Blossom, by the way. Appreciate you. I'll see you really soon. But you could go directly on my page. My prices are on there. You can just go in and book it right there. I was trying to catch up with some questions, but then I missed a bunch more questions. So I'll try to hit those tomorrow. I saw some of them there. I'll try to hit those tomorrow, and we'll be happy to help you there. I appreciate everybody. Oh, let's see. This is Audrey saying that one of her coworkers went to me. Appreciate you, Audrey. Thank you so much for letting me know. Thank you. And thank you all of you guys. Appreciate everybody that came on. I'll be happy to help you out again tomorrow. We'll go through some more things and let me know if